Hi, my name is Jennifer Hancock. I am the founder of Humanist Learning Systems and the author of several books about humanism. And today I want to talk about mental health care, self-care. And the thing is, your mental health is just as important as your physical health is. Now, granted, we have a bit more precision in physical health care than we do in mental health care, but sometimes you just have to get things done, even if the tools we're using to get it done are not perfect, right? So here's the thing, like everybody I know has some sort of mental health problem, whether they're suffering from anxiety or they're suffering from depression, or they've got a more serious mental health problem, like maybe they have schizophrenia, or any number of problems with their thinking. Now, I have a problem where if my blood sugar is low, I don't think well. Blood sugar runs the brain, right? So to a greater or lesser extent, we all have these problems. And I think the tendency is for people who don't suffer from mental health problems, we assume that when someone tells us, oh, they're depressed, or oh, they're having problems with this, we think it's part of the normal fluctuation that we ourselves experience in our daily lives, but it might not be the case. Depression is a physical problem. The brain is a physical organ, and it can malfunction physically in the same way your heart can, or your gallbladder can, or your bladder can, or your lungs can. It's an organ, it's a physical organ, and physical health problems do manifest as mental health problems, because anything that changes the chemistry about what's going on in our brain changes how we think. And we are not perfectly rational, even though we want to be. So I think the problem is, people who don't suffer from an illness in their brain think that people who are complaining about anxiety, or they're complaining about depression or something like that, they don't understand. They think, oh, well, just give it a little time and you'll feel better. Because for people who don't have an illness, that's how it works, right? You wait a little bit and things change, but you sleep on it and the next day you feel better. That's not how it works for depression. That's not how it works for anxiety. That's just not how it works, right? There's physical things going on in the brain that are causing these symptoms. And we need to think about it that way, because the stigma associated with mental health problems is preventing people from getting the care they need. And there are drugs now you can take for depression, for instance. And my husband suffers from this on occasion, and he says it's amazing not to have to suffer with this anymore, for weeks on end, right? Like if he gives it a couple of days, if he doesn't get better, he goes to a doctor. And that's what we should all be doing. And the same thing with anxiety. Sometimes you don't need drugs. Like my son has anxiety issues sometimes. We went to a counselor and they gave us some tools, right, that we could use to help him get his anxiety under control. And they work. So not everything has to be treated with drugs, but the point is that there are professionals who study these things that can help us better cope with the things that go wrong in our heads. And the very first thing we have to do is end the stigma of asking for help for this. If you're not ashamed to go to the doctor when you've broken your arm, why would you be ashamed to go to the doctor when there's a chemical imbalance in your brain that needs to be fixed? I don't get it myself. I have always taken advantage of counselors and psychologists and people like that when I have needed them, because I have needed them in my past, and they have changed my life and helped my life get back on track. Do I need to go to them forever? No, of course not. Just as you go to the doctor several times to get your you get your x-ray, get a cast, you wear the cast for a while, they take it off, they double check that everything's fine. It's the same thing with mental health often. You can go and they help you take care of your problem, and then you go on with your life. So end the stigma. If you're having problems, go get help. There's no reason not to. But there is a reason that people don't go, and that has to do with money. It costs money to see a psychologist. It costs money to get your physical health taken care of, let alone your mental health taken care of. And unfortunately, most insurance plans don't cover mental health care. I mean, they do now because the Affordable Care Act included mental health care as one of the things that had to be provided, and that helped tremendously. that might be going away. And what I want to caution is that mental health is physical health and physical health is mental health. They're not two separate things that should be treated separately by insurance. They're the same thing. The brain is a physical organ. Let me give you an example. Years ago, I was stalked, and it made me incredibly anxious and nervous because that sort of thing does. And I ended up with a nervous bladder, a physical, and when I talked to, I had to go to a urologist for it, and there was nothing physically wrong except that I was extremely nervous and it was manifesting as a nervous bladder. And that's what she said, you're probably so nervous from the stalking that it's just physically coming out in your body, because stress kills. Stress causes physical symptoms. So not dealing with the stress causes physical symptoms. And one of the ways to help prevent expensive health care is to take care of the inexpensive health care before it becomes expensive health care. One of those things is mental health care, and we should be funding it for real at a governmental level and not just in insurance. And here's why. We now know that there are a few ages at which, through childhood, where mental illness is going to manifest. And if we can identify those kids and get them mental health care early, we can have a tremendous impact on the course of their lives. Because instead of them being labeled as problem children or getting into the juvenile justice system, what if they got the mental health care they needed and became productive citizens? Wow, right? How would that change society if we did that? That requires money, right? My county has a really great mental health crisis group, and they're trying to get money to do mandatory testing of all school children at 2 different ages where they know these things tend to manifest. And that would be awesome, because it would really save a lot of kids' lives, I think, because kids do commit suicide with undiagnosed mental health problems. So this is not a minor thing. We need to be providing for the people in our community, and we need to stop neglecting mental health care. The third thing is self-care. If you are struggling with something, go get help. You are not weak for seeking help. You are smart if you seek help, because if you are suffering, don't keep suffering. Go get help so you can stop suffering. There's no reason to suffer with these problems anymore when there is medical care and mental health care available to help you. So take your mental health seriously. Do not neglect your mental health. Take care of yourself. Now, I have several psychologists that do programs on my website, Humanist Learning Systems, and one of them is Dr. Leon Seltzer, and he did a program for me calling Managing Anger in Yourself and Others. And I know I can get angry, but more often than not, I'm dealing with someone else whose anger is out of control, and it can be very, very scary to deal with someone who's not in control of their emotions. And so he's got a 1.5-hour program where he discusses what the benefits of anger are and how to use it, but also how to de-escalate things when someone around you is being toxically angry. So if you're interested in that or you're struggling with that, go on the website and check it out. All right? See you there.